Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. According to the World Health Organization (WHO), infertility affects millions of people of reproductive age worldwide. Estimates suggest that between 48 million couples and 186 million individuals live with infertility globally. In the female reproductive system, infertility may be caused by a range of abnormalities of the ovaries, uterus, fallopian tubes, and the endocrine system, among others. Fertility care encompasses the prevention, diagnosis, and treatment of infertility. Equal and equitable access to fertility care remains a challenge in most countries, particularly in low and middle-income countries. Fertility care is rarely prioritized in national universal health coverage benefit packages.
And to help us with this discussion and how best this problem can be treated and prevented, in studio we have Cecilia Karanja, who is the founder of Fertility-Kenya, and Beatrice Muthoni, a mother who has struggled with fertility issues. They'll be helping us with this discussion. Thank you, Cecilia, for being here. Thank you. Welcome to our studios, Beatrice.
Thank you.
Thank you so much. I'll begin with you, Cecilia. Let's talk about infertility. We are in an African setup where fertility is spoken in harsh tones, okay? And it's always, most of the time, a problem of the women and not men. So from where you sit as someone who deals with this case or this problem, this disease, it's a disease, right?
Yeah.
So how big of a problem is infertility in the country as we speak?
As we speak right now, it's a big problem that is really bringing a lot of problem in marriages and also in the society, because we know that if you're a parent and you don't have peace at home, it means you're not going to bring development when you go out there. 80% are women who come to us with the problem. And when we ask them about the men, they say that they are not ready to come and seek for medical attention because they feel that they are not the problem. Yeah. And most of them will come to us, or they will tell their wives, me, I've already gotten a baby outside, so I don't have a problem, which is not true, because fertility changes with time. Yeah. Yeah, you can be fertile today and tomorrow you're not fertile. You understand? I always tell people that. That is why you find that people got firstborn like 10 years ago and they're trying to conceive now and they cannot get. Yeah. We've seen that with men also. They conceive today, they make somebody pregnant today. Down the line, like 10 years, when they get married, they try conceiving, they're not conceiving.
When you talk about struggling with fertility, had you tried maybe conceiving for how many times, for how long before you could conclude, I think I have a problem?
I struggled with fertility at 7 years. Hapo ndo nilianza kwenda hospitali venye nilipata saa sipati. Venye nilienda hospitali wakaconfirm niko na shida ya blockage tube. Yeah.
So you had tried ulipomejaribu for 7 years.
Yeah.
Then you realized, no, I need to go to the hospital. There's a lot of stigma when it comes to, it's a young couple, they have come together, they are not able to have a child. Did you receive any societal stigma as a result of that?
A lot.
Maybe you can explain to us, what were they saying? What happened? Your marriage, did it stand? Yeah.
Wakati unaingia kwa ndoa una expect kupata mtoto. Sasa ukifika pale unapata upati. Sasa hapo ndo wanaanza kukuambia unawestia mtoto wetu time, unaweza toka uende. Story kama hizo.
Cecilia, you also struggled with fertility. Maybe you can also tell us, like, when did this happen and how was it like?
Okay, I think I got married when I was a little girl. Yeah. I didn't know what fertility was. The only thing I knew is that I needed a baby. I loved babies so much. My sister then had 3 beautiful babies. So for me, I knew when I was getting married, it was automatic that I'll get my baby. So I did not do any family planning. and we started trying to conceive, and baby was not coming. So I struggled with infertility for almost 10 good years before I conceived. Yeah.
And the 10 years for Beatrice, she's saying, they start saying anawestia mtoto wetu time. How about you? Was it different?
Yeah. My in-laws thought, because I'm an orphan, they thought that I was doing that so that we can get money for dowry. So they actually told me on the face that I knew I could not conceive, but I ended up being married by their son through a wedding so that we can get that money. And I knew automatically I could not. Unfortunately, I was not the problem. He was the problem. But we did not talk it out.
7 years later, you said, okay? 7 years later. So what happened after that?
Katikati ya hiyo miaka 7 ndo nilianza kujaribu kwenda hospitali. Nikapata tube zangu ndio zimeblock. Na daktari akasema kuna venye tunaweza fanya. So
hiyo ni mwaka gani? When was that?
Na jaribu tu hapo kwa hiyo miaka 7. Daktari akaniambia sababu hii tubes zako zimeblock, kuna venye tunaweza unblock. Na nikafanya surgery ya kwanza. Nikapata mimba ikatokana miezi 2. Kutoka hapo nikakaa tena, nikaachana na story ya usi. Sasa hata nikijaribu hakuna kitu inakuja. Nikarudi huko tena, waka unblock tena ya pili. Sasa nikapata ingine ikaenda ectopic. Kwenda ectopic hiyo ni kutolewa, inatolewa na hiyo tube inaenda. Na ikienda ingine ilibaki ilikuwa imeblock. Sasa hapo mimi nikaona sina otherwise na sina hopes. Venye mtu anaingianga online ndio nilipata Madam Cecilia wa Fertility-Kenya. Nikaanza kuongeanga naye, akaniambia usikufe roho, wewe kuja tuone venye tunaweza fanya. Yeye ndio alinishika mkono akanisaidia. Na sasa ndio unaniona hivi nimeshiba.
Nimeshiba sana. Okay, we'll be getting to your journey. But Cecilia, 10 years later, you got your
3 beautiful babies.
3 beautiful babies. Yes. So what changed with your hubby?
I think that time we could not handle the relationship because the pressure was too much. The fightings were too much. We had to go for counseling. We went to pastors. We tried to solve the problem. It could not work until we had to separate. I got into the other one. We were not able to conceive that time. I was the one who had the problem, and that is why I'm always saying that you should not brag that you're okay. You should support each other. So that time he was the problem. I got into this as a relationship. I was the problem. So when I got into this relationship and I was the problem, so we tried to do the laparoscopy and nothing worked. So he could not take me. We stayed for around 3 years and he kicked me out because I could not conceive. And he thought I lied because in the previous relationship,
you told him it was the hubby.
I told him. So he thought I lied, and so many people were going to him to talk about my story that Cecilia is lying to you. She will never conceive. You know, you think that you have friends, but these are friends that go behind your back to talk about you. So they went, talked about me, and that is how I ended my marriage. So now I went into depression, and finally I decided, let me wake up and run with this thing. That is how I went to do laparoscopy. I had saved some money, so I did laparoscopy, and I kept on asking doctor if it was successful, and yes, it was successful, and I was able to conceive after some few months.
Oh wow!
Yes.
What are the possible causes of infertility? Infertility
for women, if you're not conceiving, it's only 4 things. Number 1, we need to check if you have a uterus. Number 2, if your tubes are blocked, like Beatrice is saying, her tubes were blocked. She cannot conceive if her tubes are blocked. The other thing is your egg quality, if the egg quality is good or bad. Number 4 is your hormones. If the hormone, we do a hormonal analysis to check if your hormonal profile is okay. But
And
again,
what causes all those complications?
there are so many things, like if we have, there are people who are born without uterus. There are people who have fibroids, and the doctors end up removing their uterus. And that is why we are telling people, before you removed your uterus, you should seek for different doctors to confirm that you need to be removed. For the tubes, infections. If you have infections, most of the time you get treated outside, but they cannot, the treatment cannot get into the tubes. So normally you get the infection in the tube. The other thing is hormonal imbalance. It can be maybe you have PCOS, or maybe you have thyroid, or you have a problem with yourself, with your hormonal profile.
Which is, how old is your pregnancy, and what are you feeling right now?
We niko 6 months and I'm very happy. Mi hata saa zingine usiku naamkanga kuguza kama bado iko. Nje unaona kana naweza amka nipate sijashiba. So hata usiku saa zingine naamkanga naguza. Niangalie kama bado iko.
Na madaktari wanasema kila kitu iko, mtoto wako sawa?
Twins.
Oh, you are pregnant with twins?
Yes.
Oh wow, congratulations.
Kila mtu ako pahali pake.
Wow.
Wako sawa. Nafurahia hiyo kitu sana.
So when you got the results that pregnancy test results that you were carrying twins, what was your reaction?
Nakwambia hiyo siku hata nilikuwa namwambia hebu geuza hiyo kitu vizuri nione. Anageuza, naona ananiambia ndo huu mmoja, mwingine ndo.
Wow, double blessings. After losing twice, now God has restored what you lost. Okay. So what are some of the treatment options available for people struggling with fertility?
There is laparoscopy, where you open the tubes. There is IVF procedure, where now we come stimulate you. Normally every month you remove 1 egg. When you stimulate you can remove maybe like 10 or 15 eggs. We fertilize with the sperm of your husband outside there. Then we transfer the baby. So that is IVF procedure. There are people who don't have they don't have
for
uterus.
her case, how did she end up having twins? Was it her choice?
What normally happens is once we fertilize her eggs, like for example for her, how many eggs did you have? How many embryos did you have?
4.
4. She had 4 embryos. So out of the 4 embryos, Daktari transferred all the 4.
Yeah.
So she was transferred all the 4 embryos. So once we transfer the 4 embryos, you can get all the 4 babies, or 3, 2, 1, or none. Yeah, so for her she was lucky to get 2 embryos. So 2 embryos were successful. That is why she has twins. There are people who do not have the uterus, so we can do surrogacy. Somebody else can carry for them the baby. We remove her eggs, we fertilize with the husband, then we get somebody else to carry for them the baby. That is called surrogacy. We can do adoption for those people who don't want to do surrogacy. We work with adoption agency. Fertility-Kenya works with adoption agency, where they are able to come to us, and then we can connect them to the agencies. Then for men, there are men who don't have, the sperm count is low. They're given medication to take so that they can boost their sperm count. And some of them, they do not have at all. As in, when they release, they do not have. But there's a way we can get it from the testis by a process called teaser. If we are not able to get anything, then we can do sperm donation. We get somebody else to donate for you the sperm, so that the eggs of your wife can be fertilized, and then your wife can carry the baby.
Ni nini unaweza advise watu in terms of support system for couples struggling with conceiving or fertility issues?
Before ujudge mtu hapati mtoto, na sana sana wanajajingi mama hapati mtoto, inasemekana alikuwa anatumia family plan, alikuwa na abort. Kwanza nyinyi wawili mchukuane mwende hospitali, mpimwe nyinyi wawili ndo mjue shida iko wapi. Na tena wacha kubebesha mtu mmoja mzigo. ati sasa hapati mtoto nini kama hamjajua chanzo cha hii kitu.
How best can stigma be addressed honestly, because it's one of the major hindrances to addressing the fertility issues?
Okay,
Yeah.
I think the main stigma is brought about the high cost of treating infertility, because if we had access to treatment of infertility, then the stigma will not be there, because we'll be able to go and get these babies that we're having. So number one is that we should address this issue with the government. The government should be able to cater for people struggling with infertility through the NHIF cover. NHIF covers the civil servant.
The treatment for fertility is not covered?
Is not covered by any insurance. Oh. If you go with your insurance today, go and say that you want to do fertility test only or even treatment, they will not allow you to do that. So basically right now we are fighting that the government should cover our people, the people who are struggling with infertility, with NHIF. We started the conversation. And the other thing is that the insurance should be forced to cover people struggling with infertility, because this is a disease like any other. So we are trying to educate the HR, the people, the employees, the employers, to negotiate on behalf of the employees to be covered by the insurance cover, because it's so easy for them to do that. We've seen that. We've seen other companies are negotiating on behalf of their staff and they're being covered, like SCB, it's being covered. We've seen TSC, it's being covered. So basically what we are trying to say, let's have everyone, all the organization. If today insurance, let's say like any other insurance, come and say that I want you to cover your people, and then your employer say no, you have to include this. They will compare. If I'm going to lose 100 because of one person, I'd rather take it. So that is what we are trying to do. We are trying to educate employers to negotiate on behalf of the staff. Also, the other thing is that we are going out there creating awareness. We want to talk about infertility. We want people to know this is not a death sentence. This is not a big thing, and this is not a woman thing. It can be also your son, the person you're talking about. Maybe you're talking about the person who was married in your home. Maybe it's the other person. So we are trying to tell these people we should embrace these people, we should love them, we should remove the stigma by giving them support. We are also encouraging people who have already succeeded with infertility to come out and speak about their success story. Because if I speak about, if I'm struggling with infertility, and then I find Beatrice was struggling with infertility for 7 years, and now she's pregnant with kids, then I'll be able to come out. Because what happens is, if you're struggling with infertility, you tend to be down there. You don't want to come out. You don't want to talk about your story. You want to hide yourself. Little don't you know that people are talking behind your back. You understand? So if we have people coming out like Beatrice, being the ambassadors, we are really encouraging people to be ambassadors wherever they are. Let them talk about what they are going through, what they went through, so that out of that talking, they are able to end the stigma associated with infertility. Because let me say something. If, for example, we have so many teachers out there who are going through infertility, and they are covered and they don't even know. So we find teachers, they come to us, they do the procedure, they succeed, they say it was natural. You know, I conceived naturally. You know, that you're not doing any good. Go out there, tell your fellow teachers, hey, listen, I saw Cecilia, and Cecilia helped me do the procedure by referring me to a doctor. So basically what we want to do is that people should just scream this thing, that there is a solution, because the stigma is out there, because people are not talking about it. And then the other thing is that I want to talk to the in-laws. Please, please, please don't talk bad about people who are struggling with infertility. Love them, embrace them. You understand? And also even the society itself. If you have any information, maybe you're living in Lokichogio and you have access to this information, talk to the society. Call me also. I'll be willing to just come wherever they are and I'll talk to them. So basically it's just creating awareness and also ending the stigma through insurance covering. Yes, yeah.
And as you allow me to ask you one more question, Beatrice, you said that you struggled for 7 years, but at what point did it become a concern to you that I cannot conceive? Was it after 1 year, after trying for 6 months? Maybe you can tell us.
After 3 years ndo nilijua niko na shida.
Uliambiwa na daktari ambaye mwenyewe ulijua ni kama niko na shida?
Huwezi jua, lazima uende hospitali.
So after 3 years ndo ulienda hospitali, lakini before then ulikuwa unashuku, kwani mbona hatupati mtoto? Ulikuwa na wasiwasi?
Nilikuwa na wasiwasi. Saa zingine ukishikwa na stress, saa zingine hata period upotea. Inakosa kukuja like 1 week, unafikiri uko pregnant, afu inakuja. Sasa mimi nilikuwa nakakaa nikigoja venye niliona sana nimemaliza 3 years, nikaona wacha nichukue hatua. Ndio nikaambia habi twende, tukaenda naye, nikapatikana mimi ndio niko na shida.
At least your hubby was a bit supportive, which is nice of him. For her it was 7 years, for you it was 10 years. Maybe for how long? Maybe you can give us a duration where if you're not conceiving, let's say for 1 year, for 2 years, for 3 years, then should be a concern and you should seek medical attention.
For me, it's normally said that when you try conceiving if you don't conceive within 1 year, then you seek medical attention.
1 year of trying.
Yeah, 1 year of trying. But for me, I say no. You should try even before you get married. Please get to know what is happening with your body. Just get tested. Fertility test is very simple. Just walking into any fertility hospital or maybe see a gyna, tell them, Daktari, I just want you to give me a fertility test. Because if, for example, I'm getting married today and I know that I have infertility issue, it will be easier for us as a couple to deal with the problem as we get into the marriage. Because all this problem and stigma are getting in because we are getting into these marriages without knowing what is happening with us. You understand what I'm saying? So for me, I would suggest before you get married, or you should start from there. Get into this marriage. I've seen so many people who've come to me. They've told me, I got into this marriage. I told my husband that I had a problem and we started the issue. We've started the issue immediately, and they succeed along the way. They don't have to wait for 2, 3, 4, 10 years without conceiving.
We have to wrap it up now. Thank you so much, Cecilia, for coming. Thank you so much, Beatrice, for sharing your beautiful story and for being patient enough to be here with us. And once again, I really, really wish you all the best.
Thank you.
Thank you so much. Thank you so much, ladies.
Thank you.
We have to wrap it up now.
Okay.
Thank you for watching Your Health Show. It's always a great pleasure having your company. I'm Purity Museo. I'll see you again next week, same place, same time, with yet another episode of your favorite program. Enjoy the rest of your viewing and God bless.